Thank you, Mufid, for your wonderful introduction. Good morning to one and all, respected my colleagues, dear students. Warm good morning to all. In 2009, July 15th, I joined this college as a senior lecturer. Me, myself and Mufid joined on same day. And during that time, our MES Dental College first batch was in second year. So I did, I could practice extraction from oral surgery department. I learned extraction from oral surgery, and I learned endodontics, root canal treatment from our beloved principal Shamim sir. He guided me to learn root canal treatment, and almost all the treatment basics I learned from our own college. And I started my practice in 2009 December, and I am doing my practice since around 13 years. See, till now I am doing root canal, I am doing impression, episectomy, almost all surgical procedure I am doing, biopsy, etc. But till now I was not think about implant. But many times patient come and ask about implant. We used to take consultation from different people. Okay, so now I thought to explain, it's better to know in detail ourselves, then only we will convince the patient. This is the picture of, I'll come back to the Korea. This is the picture of Korea. You can see that one river is running. You can see many bridges, around 30 to 40 bridges are there like that. It's a beautiful place. You can see it's a highly disciplined country. Okay, and once we arrive there, we have to go through COVID test, RT-PCR. Okay, even though we have done a test here, we have to once again we have to do. They have done a temporary setup just front of the airport, and that too they are taking deep from our nose. I think it's base of the skull. They are taking specimen. It was very horrible. And after getting result only we could go outside. We have to stay in hotel. Then once the result out by evening, we can go outside. Like that, it's the protocol. It's and that it was like they are taking from base of the skull, like that much from the brain, that much deep. The entire day I was sneezing. Okay, so the country like a developed country, they are still following the protocol. And imagine our country. See, even myself now I am not wearing the mask. Okay, this is that airport view from outside. Okay, it's a beautiful. It's from inside you can see that many plants, everything natural and artificial plants, etc. Then nice, beautifully they are constructed. This is the picture of the Dentium implant factory. We had a factory visit in the next day. It's a beautiful. It's a highly. This is our entire team in front of the Dentium factory. I think you can recognize me. And these are the many products they displayed in the ground floor, like block for ceramic blocks and all. They have not only the implant, they are doing many other things, CBCT and RVG, many things, many all machines, even dental chair they are doing. It's all really quality stuffs. Okay, these are some blocks that most of people might be knowing, will be able to recognize better. And the factory, you can see that around they are supplying around 130 countries. So from each country people used to come there. So to make a translator for each country, it's not that easy. So they developed one robot for that. Okay, that robot will explain the in their specific language. We can set in that language. That robot will come and explain well. So if you come across in front of that robot, that itself will say that you move aside, mister, like that. Okay, these are the rainbow blocks. Coming back to that implants, we have different, see that their research is going on, and every day, like a narrow implant, like baseline implant, super line, NR line, like that implants they are developing. This is like a scanner, vertical scanner. Usually we used to do the horizontal scanner. This is vertical scanner. We can do the scanning in a standing position, not in the lying position. That ring thing will go up and down. That can identify better diagnosis and against gravity, all these things they are telling. So this is the dental chair. It's having very highly qualified. I mean, it's having many features, like that light area itself have a camera, so that the surgery and all lively they can demonstrate. Even speaker that is having, so that the surgeon's voice also can be recorded, like that. Many features are there. You can see that behind this is that robot I was talking about. This robot, we have many settings. That robot will explain about what and all things are they, explain the features of each in detail. Okay, so that everything is like they are well advanced, no need of any assistance. That itself will go here and there. We will explain about that. Everything is feeded, so that we will explain in very well in our specific languages, because language also we can set in this machine. And like this, you can see that area, you can language you can set, and country you can set, everything you can set. This is the another picture of that same robot. Robot is going here and there. See, if you move in front of that, you can see that scanners, RVG and all, because they are selling around 200 production capacity of 200 RVG in a month they are doing. Okay, around 20 implants in a month they are supplying. So like that much capacity they have, that much quality, quality stuff and quality accredited factory it is. And we cannot enter to the inside the factory. Inside the factory means that some UV sterilization, all this area we cannot move. We can see through the glass, with a full gown and all, PPE kit and all, people are working within it. These are the millers that is used in milling machine. Prosto people will be knowing better. These are the different stains used in ceramics, and these are the CAD/CAM machine. Okay, CAD/CAM unit, advanced interface, and collagen membrane for bone loss areas and all. They used to place artificial collagen membrane and bone graft, artificial bone, etc. All they are working on it. And here also we can see that the area where this one bone thickness is not there, you can see that bone supported cortical bone supported implants. Okay, that cast partial denture sort of thing, that framework they are developing, and so you can place the implants. Okay, the area, because the mandibular canal and mandibular nerve is running, so if there is no enough thickness, you can go for this. This is the which I told that vertical this one scanner, CT scan, vertical, that will go up and down, so it will have more precise diagnosis and diagnostical. Nowadays it's coming to the market in future. I hope within 5 or 10 years it will come into the Indian market. Okay, so many happenings or changes happening in the field of medicine and dentistry. And this guy standing along with me, he is a Pratyush, Dr. Pratyush. He is a very 2018 pass out, but he's doing cosmetic treatment, and he's doing giving training also, like lip fillers, botox injection, etc. This is the immediate placement of implant area after root extraction. This one immediate placement of implants. This is the robotic, the future of dentistry, that the robot is placing implants. So these are they are working on it. Is planning. Once we set the plan, it will come and it will place the implant. Okay. So these are they are working on it. So these are the future of dentistry. So we are far behind. We are far behind. We have to go along with the technology. Otherwise, the things will go from our hand. Okay. So this travel reminded me a lot of things, like our college or academics. Everything we have to be updated. We should know what is happening in outside, because we think that everything is happening, all the new things happening in colleges, but not like that. There are many things happening outside. Everything we cannot accommodate. These are the armamentarium they kept for our basic hands-on procedure. See, everything those they are using for patient, same thing they kept for this one, all their product itself, all even that jaws for placing implant. I'll show you. These are the jaws. They mimic and like our natural tooth and natural jaws will have same consistency. Even that spongy bone, cortical bone, everything they have their own like consistency. So we will have that same effect. Even that the mucosa, that incision, reflection, everything will have that effect. Like that they made their products. Okay, so even sinus lift, actually the course was like advanced course. For me it was I was a beginner. They make us to do the sinus lift procedure, like making a hole and lifting the sinus and ballooning, etc. All they made us to do in these jaws. Okay, it was a wonderful experience. And see, the people was along with me, all the they are doing implants since many years. So I was a beginner in that field. So these are the colleagues was there along with me. This person, you might be remembering this guy. This guy, he's Jojo. He was our former staff in Department of Prosthodontics. Okay, he is having clinic in Alua. His clinic is NABH accredited, and he is having like VIP clients like film stars and politicians, etc. So he is having that scanner in, no need of taking impression in alginate and all. He is having scanner, all these new things he is having. So the developments are happening in outside also, not only in college. So I think management should think about like updating each thing, at least one or two new mechanisms or machineries. Okay, I hope management, some people will be there, so that these, see, you can see that LCD projector is having adjustment. For that will come down, even that LCD projector screen will come down. That time they can do the adjustment here, everything. That things can be copied for management people. They can do like doing lecture, setting the new lecture hall and all. They can see the seating arrangement for lecturing and all. Beautifully they arranged. These are some of the photos from the outside of this one, and this is the certificate they played. Now we will go back to rather than our theory or about implant, I will go back to what I have seen in Korea other than the dentistry. You can see these cycles or sort of thing, which is having this. You can see everywhere in the street. See, it's like a driverless auto rickshaw. It's like you have an app. We can recharge it. You can scan it and we can transfer the amount, so that you can travel in this, and wherever you region you can keep it there and go, no problem, because next person will come. If you want to use, he will use it like that. There is no driver, no one is there to take care. It's like that much they are disciplined country. and see that everything for this the construction is going like 40-50 floor construction and all. No? You can see that it is all in steel structure, not in the core. Steel structure and what concrete also they are doing, because not in the pillar and all. See, in such a developed country they are using steel and all. In our country we have enough steel, but still we are only doing this one concrete and all. Now these are our like tour guides, and these are the COVID test they have done. One of our tour mate got this one COVID positive, so it was a bit tough time for her, and because of while she was traveling and become positive, and she had to go to PHC and all, and give explanation, and she may have to go for quarantine for 1 week. Like that discussion was going on, and when they were discussing this matter in public transport, the driver heard this and he immediately called police, and police and ambulance all came, and they had a discussion and all, and they gave explanation about this one vaccine result, everything they gave, 2 doses of vaccine they have taken, everything they explained, and they relieved, because that even that public is well aware about this one COVID and all. And if you are not wearing mask, the public will make us to wear the mask, because that much they are disciplined, self-discipline. If you want to travel in bus, first we have to take from the supermarket we have to take a card, and we have to recharge, and you have to swipe, and enter to the bus. Like that system they have. Only driver will be there. Through the driver side you can see one scanner. Through that you can scan and pay the amount, and you can travel it any bus, like that. And this I can see that buses and big glasses, so that we can view the entire street, everything. These are the police department. They are there to help us for traveler or tourist to help. They will have their map, so wherever we are stuck they will where to go, like that they will explain, and they will have a software in their mobile, like a translator. Okay, so if you speak in English, they will get that translator will explain that in Korea, and they will speak in Korea, that will translate in English, like that. So they have that app that also they developed. Okay, such a wonderful country. You can see that down there is a street, like how neatly they maintained street food and all they are preparing. In hotel you can see, like in our hotel everything will be in a single chart. Everything to eat, different, to know, to do, everything they kept in a systematic way. Just captured that photo. Okay, nothing much. And these are some LCD sort of thing, projector sort of thing. If you have something to arrow mark in a ground floor, if you have 4 directions, for each direction, if you want to write something, instead of sticking the stickers and all, they projected here, because next day if they want to change something, they can change it. And like that, from the roof they projected to the floor. Okay, it was very attractive. And this is some of the picture I have captured from the airport. You can see that it's a shop of a lens shop or a specs shop. They are showing that 3D, how that pictures are our vision happen, everything in system. I mean 3D they have shown. The bus, from the bus you can see that each bus behind there is a charger port. It might be there here also. These are the pictures I captured from cruise. We had a one-day dinner in the cruise, and it was a wonderful experience. This is a amazing thing. You can see that in a hotel, after having food, no one is coming to collect the our plates. If you have a button in the table, if you press that machine itself will come. We just have to keep our used plates in that boxes, so that it will carry that to kitchen for washing. It's a wonderful robotic sort of thing. Hope these all things will come in India also after quite some time. And these are the pictures I captured from from the ship, and it's a night. It's wonderful. And these are gangs. If we Burj Khalifa, we have so there are so many buildings which is showing that videos, Charlie Chaplin or some movies, night shows. So they are playing with the light and LEDs and all many things. And these are some of our gangs. In airport I also seen one for kids to play, some area, big room they kept for blocks to play with blocks for kids. It was wonderful. I mean, I find it very different, so I captured that photo. Okay, so these are the one of our friends. Say different people have different way of like relaxation and enjoyment. Okay, so this guy is a wonderful guy. See, he was the entire 3 days he didn't sleep only because he was like exploring that entire Korea, because he was telling that we have not come here for sleeping, to explore and wherever we go we should utilize our time in there maximum, like that is his concept. So he was like entire night he was outside playing with his friends and all, like he enjoyed. So these are I showed that cycle. You can see everywhere. See how neatly they maintained this tree and all. So you cannot see even a paper piece there, because that much neatly they maintain their country. Okay, see, everyone self-discipline. No one is there to control, but everything is visible. These are some of their traditional architecture. These are I have taken photos of some Korean kids, and these are our gangs. These are from the evening, like sunset and night. These are a hotel we stayed, and these are some of the see all these foods and all. We can see that everything looks very good, but nothing cannot have not have much taste, because everything is raw, not cooked properly, because they are used to it, but we are not used to it. So you can see that prawn, it's like a big prawn and all, but not half cooked. Okay, we cannot have. Only thing we can have is like some sweets or some vegetables, etc. We'll have. Okay, and these are some rental shop also. You can see here. I think for marriage and all, no need of purchasing new dress. You can take for a few days and have fun. It's different things I have seen there. Okay, nice like a road, everything is like traffic, everything. You cannot see any police people, but everything is it's a developed countries, like everything is there, like camera, everything systematic. So you can see that wall, it's like a 3D wall. It is you can see that water is falling. It's like you feel it's like it's a real happening. It's a effect of light and play with the LED and all. So you can see that street and all, how neatly they are maintained. You can see. Can you imagine what? Can you guess what it is? It's a tree having some fluid is giving. Can you see that some glucose and some like cannula and all? You can see. See this can urinary bag. Some medicines are giving like that. Can you see? See, they are treating their. I think this tree is having some fever or something since last 2 weeks. And they are treating that trees and giving medicine for that trees. How they see in our country, we are not treating for human. If some accident, something happened, we will be busy in capturing the photos. See now how they are respecting their trees and giving treatment, how maintaining, how these all things are some developed countries happening. There are lots of things to learn from other countries. Okay, these are some of the architecture. And this I have already shown that this one, and these are some of the photos, and it was like from photo. These are some of the friends I met during that Korea visit, all like different from different part of the country. And this was there in like airport. Like I have seen that they did a amazing picture by using some beads and strings. This is their traditional piano, their songs they used to play. They are playing in airport, and nicely they did. I was traveling there through daytime, night. I don't know how it looks. Maybe some light effects will be there. It was different. So this. This is some toilet picture. See, have you seen? Some of you might have seen that remote control, like electrical. We have so many options, like kids, like ladies, gents, or anterior posture, different. So that depends upon that. The water will come and it will be see different things. I have seen different things. I have captured the photos. Okay. So this is a different city. So while traveling, I preferred a Korean meal. So I thought I'll have because it was looked very good, but it was not tasty because all You can see that some like this one vegetables, in that you can see some shrimps, this one. These are our gang. We reached in here Delhi. From the Delhi, so I could meet different people, otherwise there is no chance to meet because of the Korea trip. These are the, again, I told you, first I did advanced course, then I realized that I have to do basic course. Then I had gone to Kohlapur in last week, and so this sir was there in Korea trip, so he conducting implant course. So he traveled to Kohlapur. Okay, so around 17 people were there in a batch. So he made all the 17 people to make implant, and there was first day there was a hands-on course, and he will make it, since it was in a good hotel. So he made us to like live demonstration of implant will be there. When one person is placing implant, all other people can see. Or he made all the 17 people to make implant. These are some new gadgets like trays are there to place the implants in the correct position. There are some plates and all. Some new things are the scanners, etc. Okay, so there are so many things are happening, so we should update in our field. So these are the live demonstration. I mean, they are doing demonstration. His clinic. Okay, his clinic, he made all the 17 people to make the implants. Okay, it was a wonderful experience. See, he did many, like he's practicing implantology from since 2013. He's having his own cases for each instrument. He kept sterilization and packed everything. See that how many assistants he's having. He having 2-3 camera like TV sort of things. So one screen will shows like OPG, one show it will CBCT. So the surgery what he is doing. So everything is like very systematic. Okay, so everything he did in I think in our college also at least one year we should have such an arrangement to do such a big surgery or implant and all. We have such arrangement. Interior also should be there, but infrastructure, I mean, like procedure sort and aspect also. This guy, see, this guy is not having one leg. He is 85-year old, and he is he's like his life, how his visions, like he is 85, still he came to for implant FPD for his 8 lakhs or something. See, he came along with his wife, and see, just imagine in our country, in our place, and all for 85-year-old, whether we'll allow them to go out alone or not. So that is the different people will have different way of thoughts and different life attitude. Everything matters for everything. So when you travel in different areas of our country itself, you can see, you can make out. That is the end of my presentation. Thank you one and all.